I think the fundamental issue is that to be in housing stress or to be not in housing stress, you shouldn't be paying more than 30% of your income on rent.
Yes.
And if you're on a fixed income like the age pension, job seeker, disability support, even if rents were to be capped now, most people on those incomes are not able to afford the rent as it is.
Yes.
So I think we do need to look at rent control in some way to, like you say, have some sort of predictability around those rent increases. But there is not going to be a market solution for the 85,000 people in Victoria right now who are 55 plus, who are on the lowest income quintiles, who are not going to be able to afford the rent no matter how it's capped at the moment. And those figures are based on data from 2019-2020, which is before the rent increases now.
Yes.
So there's 160,000 people in Victoria at the moment, 55 plus, who are renting. The whole of Australia's pension system and support systems is based on the assumption that people own their own homes. So the rates themselves presume that you're not paying more than 30% on household costs, but the reality is that you are. And so if you take away that housing cost, then you can afford to live potentially on these fixed incomes. But at the moment, with the rents now, even if they were to be capped right now, you're not going to be able to afford it. So we need to have rent control for the future, but for right now, we need to have a massive increase in public and community housing to fulfil that market, that non-market solution for those people. People are being pushed out of the communities where they live because the rental availability isn't there. The other thing that we've been told is that landlords, if there was to be a rent cap, would simply pull that out of the rental market and into the short stay market, and therefore make more money on it. And I think we need to have both regulation around rentals, but regulation around short stay accommodation as well to make sure that that doesn't happen. Down the Mornington Peninsula, we hear there's a massive rental crisis down there, and the houses are being leased for short-term renters because they are more lucrative for the owner.
Definitely. Thank you.
I think our organisation supports inclusionary zoning being in all new builds, not just publicly owned land, but wherever there's a development going up, a proportion of that should be some type of community housing or public housing. Affordable housing, we think, needs to be better defined, and that needs to be enforced because 75% or 80% of the market rate is not affordable. And we also need to ensure that component is actually quality housing. So it's not the dodgy apartment down the back of a beautiful block, which is sometimes the case. So where I live in a city in the Footscray, there's empty blocks going up all the time. There's people homeless on the street right in front of them. It seems like a very big disparity between the need and the housing stock. So we need to level the playing field, and if planning permission is to be given, then it must include by law some form of inclusionary zoning for affordable and public housing. Unfortunately, it's not enough, and we're seeing public housing at the moment that's been demolished through the Public Housing Renewal Program with the proposed 10% increase. 10% is just not enough, and our view is that public land should be earmarked for public housing because land is valuable and government land is even more valuable. So let's leverage that to be able to provide as much housing that's government housing that can stay there in perpetuity for the good of the tenants. So we really do think that public land needs to be used for public housing because land is valuable, especially land in desirable places to live where there's connections to community, where there's medical services, where there's transport. So it's very important that we hold on to that valuable thing that Australian taxpayers have, Victorian taxpayers have, which is our land assets. Rent is capped at 25% of their income, and they can age in place. They can stay there as long as they need to. So those two elements are really important, but we also need to have minimum standards around cooling, as has been mentioned today, and accessibility. So yes, we absolutely support public housing for those reasons, and we do think that government needs to provide housing for the people where there's no market solution, which is a lot of people.
Yeah.
And yeah, I think in terms of how to make that supply happen quickly, we've got lots of suggestions there, and I'm sure you would have heard today. But in terms of ageing in place, Victoria does have 55 plus specific housing, which is fantastic. We do have priority access on the Victorian Housing Register for people aged 55 plus. Both of those things are good things. We just need a lot more stock, well-designed stock in places where people want to live. There used to be types of housing which was well located and connected to communities, independent living units and low cost retirement housing that was basically dotted throughout all of the suburbs and a lot of the small towns as well. And that was often a very attractive option for older people, particularly those on low incomes or with low amounts of assets, where they could age in place, they could be around the community, and they could be renters for life, or they could actually purchase their homes as well. But that type of housing stock has been in decline basically since the 1980s. And now we think it's, even in the last 10 years or so, has declined by at least 50%. It used to be supported by government, and it was run often by small not-for-profits, so the Lions Clubs and the RSLs and things like that. But with that decline, it means that there are less and less affordable options because they're being sold off because of the land being valuable or being replaced with much more expensive retirement housing options, which have ingoings of $400,000, say, which no one can afford if they're on low income. So we did used to have options, we did used to support them, but the sheer volume of the ageing population in conjunction with the housing crisis and the decline of those types of housing means that we're really at a crisis point now for the older population, particularly those that have been lifelong renters or on low incomes for their whole lives. And this is why we need some action now, because it really is truly a crisis. We conducted a survey a couple of years ago, just prior to COVID, that interviewed and surveyed online and did some follow-up small groups with about 227, I think it was, older LGBTI folk. And what we found in that was that there was really high numbers of older people who weren't in home ownership, who were in private rental, and who were living, like you say, in unconventional housing situations like sharing with friends, or perhaps living in the back room of an ex's house, things like this. And so what we also found, which was really upsetting, I guess, was that lots of people in that cohort did not know where to go for help at all, did not consider themselves to be at risk, and had no idea of what services were available. And in talking about their aspirations for housing, which is what you also alluded to, there was that idea of wanting to live in communities where, maybe not exclusively LGBTI communities, but communities where they have allies and they felt safe. And there are some examples of that overseas, but there's very few examples of that in Australia. And where they do exist, it's often for higher income people. So people that are in private rental who are paying high amounts of rent and who don't have any assets find it very difficult to find safe housing. And this is a particularly problematic for older LGBTI folk who may be discriminated against in the private rental market, who may not feel safe in the housing options that do exist, and do want to remain, as most older people do, in the places that they're familiar with, and they don't necessarily want to be pushed out into cheaper options where they may not have the same social supports and the same connections with the community.